Hey guys, it's finally time. I'm looking forward to, I'm really excited, very excited. Here we are.
Hello,
Hi, how are you?
I'm good. How are you?
I am doing good. Dr. Tolu in the house. So we're
Yes.
just going to give a little bit. I think we have a few people have joined in right now.
Yeah,
So
and
I'm
more
really
people. Yeah, the numbers seem to be climbing now, so that's good.
I'm excited. I'm very
Yeah.
excited. So I'm going to say good morning to everyone. So I am really excited about today because I want to discuss or just kind of talk about something that we never get a chance to talk about. And who better to have the first conversation, the first meal on my show, Dr. Tolu. So one of the topic for today is breast cancer and men. So we're going to address the issues, the symptoms, the diagnosis, and the cultural stigma. So I would like, before we even start, I would like for Dr. Tola, I'd like for you to kind of introduce yourself to the people so they get to know
Okay.
more about you. And then we can just go into a very interesting forum today.
Okay. First of all, thank you for having me on your show. Yeah, I know on your show you have more women than men ever. I don't think you've ever had. Yeah, so I'm probably the first man, which no pressure. So yeah, about myself. My name is Tolu. I'm a medical doctor. I've been practicing medicine for, wait, that's a good question. How long? I think I've been practicing medicine for more than 7, 8, yeah, about 8 years.
Okay,
Um, I
that's
yeah,
good.
I went to medical school in Nigeria and then I moved to the UK to do my residency program. So my program is in psychiatry, but
Okay.
then as you find in a lot of doctors, I also have interests in a lot of other areas apart from psychiatry. In fact, I talk more about um, female sexual health than
Oh, I see a lot
mental
of
health.
that
Yeah,
on your
yeah,
page.
I do a lot of that, and yeah, so when I got the invitation to talk about this, I was like, okay, this is something interesting because I've spoken about breast cancer once or twice, but I focused more on the women because we find I think more than 99% of cases of breast cancer in women. But then you made me realize that the fact that the statistics say that breast cancer in men occurs in less than 1% of all breast cancer cases, the people who are affected by these statistics are still human beings. And to them, they are more than, just statistics. So we also need to pay attention to them, which is one of the main reasons why I decided to, come on the
To be
show.
a part of this. Yeah.
Yes.
You know, a lot of times we talk about when you mention breast cancer, you immediately associate that to women. You know, it's
Yes.
something, it's a woman's disease.
Hmm.
But a lot of times, we tend to forget the minority number, which is the
Yeah.
men too, who do have breast cancer. And coming from Africa, which a lot of people know, it's not something that you even talk about. I mean,
Yeah.
you can imagine how difficult it is to talk about breast cancer amongst women. Then you talk about men, So for me, the whole idea today is as we talk about breast cancer and men, my thing, that the point that I'm trying to bring out today is for the men to let that ego, the man
Hmm.
ego down and just kind of get in touch to their feminine side
Yeah.
and be able to talk about diseases such as breast cancer, which does affect, as much as I say, less than 1%, but they're still humans, like you said.
Yes.
So, in kicking off, first of all, how would you explain to me and the rest of the people watching what is breast cancer, and
Okay.
how do men perceive it when we talk
Okay.
about that?
So I personally, I think cancer is probably the worst illness known to man, right? Because it's 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 it grows with a vengeance. Let me explain. So the way cancer works, cancer happens when the normal cell division multiplication goes wrong, and then it leads to the creation of abnormal cells. Now, the thing about cell replication is it doesn't matter if it's happening to normal cells or abnormal cells, it happens
Mhm.
really fast. So
Okay.
with cancer, when there is that deviation from, normal replication, the abnormal cells that come out of it also replicate really fast. And then it is in this replication that they then gather around to form a tumor. So with breast cancer, what happens is because the cells grow really fast, the abnormality, first of all, occurs in the breast tissue, and then it multiplies really fast and gathers and forms a tumor. And if this isn't, so the tumor is what we usually see as the lump, which is what we try to get women to discover early by teaching them, breast self-examination. So if this tumor isn't caught on time, then sometimes it travels through lymph vessels and goes to other parts of the body, which is what we call metastasis, the
Mm-hmm.
spread of this. So it's like you have bad cells that give birth really fast, and then the offspring of the bad cells travel all over the country really fast. So,
True.
and
Very true.
yes,
Very true.
yeah, so that's basically, it's just like, this thing happening, but starting within the breast tissue. That's what breast cancer is. Now, I just want to say that most lumps we find in the breast tissue are benign. What that means is they are not cancerous. They are not life-threatening, and many times they just stay within that location. For instance, when you talk about maybe a fibroadenoma, for instance, it just stays within that location and can be removed, and there'll be no problems afterwards. But then, even though the cancerous cells are in the minority, but because they are so lethal and they cause such havoc, they wreak such havoc if not treated on time. So, it's best to just assume that every lump is bad and you just go to see your doctor. Let your doctor
Okay.
decide. Yeah.
So in a case like, let's say, for example, men, okay?
Yeah.
A lot of times we ask questions, men have flat chest walls. They're not like women.
Yeah.
So how does that happen? Because a lot of times people ask that question, why would a man have breast cancer? They have
Yeah.
flat chest walls. So can you explain more about that?
Okay. So the thing about, like I said, cancer affects tissues. And for the breast is no exception because the breast or the chest has breast tissues. So with men also have breast tissue. It's not just women who have breast tissue. The only thing is
Thank you.
puberty is like the junction where women go this way and men go off this way, right? Before puberty, both male and female children have breast tissue. In fact, almost the same amount, right? And then the breast tissue is made up mainly of ducts. Um, I would not want to go too deep into all that jargon,
Yeah.
but anyway, so yeah, okay.
No, go ahead. I'm listening.
Oh, okay.
I'm
So
listening.
at puberty, the women develop more female hormones. Now we call them female hormones. We call some female hormones, some male hormones, but in the end, both sexes have both kinds of
Both.
hormones, right? But women have more of what we call the female, and men have more of what we call the male hormones. So when women with puberty, women have like a spike in their female hormones, and what that does is it helps to develop the breast tissue far more than it does in men,
Okay.
right? So yeah, so
So
women
that's
have
probably why the numbers are low. Okay.
exactly. So that's
Okay.
why women have more breast tissue, and with the breast tissue, they have a higher chance of getting, cancer than men. But then men also have breast tissue, so men can get breast cancer.
Okay, so what are the what are the risk factors that men should look out for? Because a lot of times, they're in denial, just like,
Yeah.
we're in denial. So you can imagine a man with all the ego and pride. So they're like more in denial than women. So what should they look out for?
Okay. So for men, breast cancer, we've noticed that for men, it happens more in men who are 60 years and above. So age is an important risk factor. If, as a man, you find that you're 60 and above, and then you wake up one morning and you find that you have a lump around, your areola, that's the hyperpigment. Okay, let me know it's the big. That's the darkened tissue where you have the nipple at the
Yeah.
center, the
Hmm.
areola. If you
Hmm.
notice that maybe you one day you decide that okay, you're going to wake up and go play golf, and then you just realize when you're having your bath that okay, I seem to have this lump somewhere there, then it's best not to ignore it. Now, that said, we also see breast cancer in younger men. So it's not just, exclusively for elderly
Yeah,
men, right? So yeah.
I read that the youngest man to be diagnosed with breast cancer was 25.
Yeah,
I
it's
mean, I've
possible.
always known that it's a lot when they're older, but the
Yeah,
youngest so far it's 25.
yeah.
And why?
So yeah.
Why? Why
Yeah,
is
so
that?
it can affect younger men because which brings me to another risk factor. Sometimes it runs in families, right? So that comes with the genetic aspect of things. There's this gene we call the BRCA2 gene.
Hmm.
Yeah, and that's been heavily linked or implicated in breast cancer cases in both men and women,
In
right?
women.
Yeah,
Okay.
so in some men it runs in the family, and usually those men that have it in their families know. Because I mean, if a man had it in your family, it kind of goes round. Everyone in the family knows that, oh my God, okay, this is not normal. Yeah. So that's another risk factor. Another thing that could predispose is if, for some reason you are on some estrogen therapy. That estrogen is one of the female hormones I mentioned, right? And sometimes we use it, sometimes we give medication that have some estrogen in them. So if you find that you're on some estrogen therapy, it kind of slightly increases the risk in those men. Also, unhealthy habits, smoking, drinking, living a stressful life, any kind of thing that can predispose to, the abnormal cell replication that I mentioned earlier is also a factor. Also, some men find out that for some reason they just have more breast tissue. You find those men who look like, their breasts are probably bigger than those of some women. So gynecomastia, that's what we call it. They're also at a higher risk of this problem. So yeah, those are just some of the risk factors. Then I think in terms of race, I'm not sure. I'm not sure if there's any clear um, predisposition when race is concerned. The only thing I know is the prognosis is worse in black men than in white men, and that's partly because there's more awareness of breast cancer in men in white population than in
Yeah,
black
it is.
population,
And
and
that's
there's
the
greater
next thing.
denial. Yeah, there's greater denial with black men. They're like we've not even wrapped our heads around breast cancer in women. You now want to tell me that I can also have, like, I don't have breast. Go away with this information. You get
I
so
know
that
that
yeah.
that is yeah, that's like the next thing that I wanted to address, coming from Africa. and
Yeah.
some other parts of the country, not just
Yeah.
Africa, but I can only speak to where I'm very familiar with.
Yeah.
I mean, they have not just Africa, but black men, in other countries, Caribbean islands. Um, we talk about, I mean, of course, it's something that's very difficult to talk about. Okay.
Mm-hmm.
And then when they do, or rather, some people, some people don't present early because of that shame.
Yeah.
Because in Africa, there's this cultural stigma where you don't get to talk about it. So other men or whatever the situation is don't get to make mockery of you, laugh at you or something. So people just rather, do it in secrecy. And we
Yeah.
do know that when you present early, there are chances of you, getting
Yeah.
treated on time. But I know that not just Nigeria, not just Africa or any other place, a lot of men don't present early because it's not something they're looking forward to. It's not something
Yeah.
that they're comfortable with. How do we address that kind of, how do we create, because I think it's time to create more awareness about breast cancer in men.
Mm-hmm.
As much as we create for women, I think it's very important that we do that too, because we have sons, we have husbands, we have, men in our lives that need to
Yeah.
be aware. So, what is the best way, to kind of address this issue, to bring it to the light and make it very comfortable for people so that, like I said, the ego, the pride goes down and your feminine side, you embrace your feminine side and kind of address things like
Yeah.
this.
Okay, so it's very important for men to realize that we are we are not so different in terms of anatomy, biochemical and physiological composition. We are not so different from women, right? Uh, Here's what I mean. Now, what I mean is basically you can find, like, I mentioned about hormones, right? That both female sex hormones can be found to some degree in men as well, and male sex hormones can be found to some degree in women, right? It's only when there's too much of it in either party that's when there's an abnormality. So men need to realize that awareness is key, very important, right? And to show you how much awareness we need to create, especially for men. I don't think about breast cancer in men, and I'm a doctor. Right? I know it's somewhere at the back of my mind, but I don't really talk about it. And this chat has made me realize that it starts with me, it starts with you, it starts with those
Thank
of us
you.
who
Thank
know
you.
about it. Yeah, because breast cancer has gotten a lot of media coverage and awareness. In fact, I think the only kind of cancer that comes close to breast cancer in terms of, sponsorship and awareness is cervical cancer. But cervical cancer is still a distant second. That's because breast cancer has gotten a lot of awareness. But then with the awareness has come the feminine coloration of the illness, right? So, I mean, down to the color, you have a pink ribbon. That's breast cancer. Meanwhile, it's something that affects both sexes. Yes, it's less than 1%, but when you look at the less than 1% in terms of numbers, it probably amounts to thousands.
Mm-hmm.
And thousands are a lot, especially for the people affected. I mean, no one likes to think of themselves in terms of, a statistic. Everyone is unique. And
Yeah, I mean,
medicine should be, yeah,
you've heard of the term real men wear pink.
yeah.
So, regardless of the pink ribbon, if you embrace it,
Hmm.
that means you're being real with yourself and you're
Hmm.
finally addressing the core, the
Yeah.
issue that we're dealing with. So, another thing I want to talk about is, okay, say for example, the breast cancer diagnosis, you come in terms with that, and then you go through the chemo the chemo
Yeah.
treatments and radiation. So many a times, as a doctor, I'm going to ask you. I know a lot of times when you go through chemotherapy, or the treatments, um, in a personal light, okay, when you go through chemo, sometimes you lose the sexual drive
Yeah.
for a woman. So how can men come to terms with this? And how does it affect them? Because it's not something that, you're not in control of it. It's just what it
Yeah.
is. So how can you address men who are currently going through this and to kind of bring down the walls and explain to their partner what they're going through? Because it deals with communication,
Yeah.
right? So as a man, how would you advise a man to handle this?
What I would advise the man to do is to break down those walls that we've had to build as men. So as a man, partly because of what society expects, and also partly because how we are raised. We are raised to have this, macho approach to things. And the macho approach to things usually means there's very little communication, right? And there is
True.
more, keep things inside. Now, to be honest, many men would love to be able to communicate, but partly because, and I'm being truthful, partly because of what is expected of men, especially what's painted by the media and everything, do not we do not feel free enough to just open up, especially to women, right? And that's one thing women really appreciate, when they can see the vulnerable side of you. Now,
Exactly.
yeah, bringing this to treatment for cancer. Treatment for cancer of any kind, is tough, right? The drugs used, especially when you talk about radiotherapy, where we use radiation, and chemotherapy, where we use drugs, cytotoxic drugs, are they are very non-specific. Here's what this means. They don't just go for the abnormal cells, they go for everything and destroy everything. So it depends on the ability of the doctor to guide them so as to minimize collateral damage. And some of this collateral damage we see is hair loss. Some of it is the reduction in sex drive, weight loss. Loss of color. If it begins to affect mental health, right? So for men to be able to cope with this, we need to be able to open up to those closest to us, to our loved ones. Let them know exactly how this is affecting us, so that whatever treatment we are receiving is what we call because my specialty is actually in psychiatry, and we have what we call the biopsychosocial approach to treatment. That's treatment that affects biology, that's the medical aspect, psychology, that's like this kind of expensive, and then the socio-environmental aspect, that's regarding family.
Mm-hmm.
So we've come to realize that the best way to approach, mental health treatment, the holistic approach, is dealing with these three aspects of the person. So
Okay.
when you talk about radiotherapy and chemotherapy, that's the bio aspect of things. Then the psycho aspect is about mental health, maybe talking to your doctor, talking to your loved ones, right? And then you now have the social part, that's the social environmental aspect, where your family comes in, your community, your church. All these people can help you to keep a brave and optimistic front and approach, to your treatment. So it's very important. And an important aspect of this thing is vulnerability. You cannot carry the weight of cancer treatment all by yourself. It is hard.
Thank you. That's a
It
good
is
one.
tough.
Yes.
And
Yes.
you need to have a support structure.
Exactly.
So make use of the support structure you have. If it's your wife, if it's your kids, if it's your pastor, if it's your community, maybe you have a community of those who have survived cancer treatment. And we really recommend this because many times when it comes to treatment, it's very easy to just focus on the biological aspect of things. Okay, let's kill the cancer cells, let's get them. But we found out that with cancer treatment or recovery, as with recovery in any other area of medicine, you need to have your mental health and you need to have your mental health optimal, and you also need to have a good support structure to help you through. Because I mean, you can kill all the cancer cells, but your morale is down, and then there's a link between, funny enough, yes, there's a medical link between low morale and low pessimism, and also pessimism has a strong link to predisposition to illnesses.
Mm-hmm.
And with cancer treatment, your immunity is already going to be affected, right? You're not going to be as strong as you normally would be to fight off infections. But having your mental health, having mental health support, and also having family support actually boosts mental health, and that can also boost immunity.
Yeah, I mean, I just having a support system, because I know a lot of times, women tend to form these forums, this support system where you get to talk about it. For me, when I was diagnosed, I had very wonderful, friends around me. So it wasn't, and to say that I was pretty much the first in my girl group to talk about breast cancer. They have questions. So I think the same can be done for men, where they're able to have this forum where, you get to talk about it. There's no pride, there's no shame in this.
Exactly.
Because the whole idea is standing up to it, addressing it, because through your story, you can help someone else. And that's the whole thing. Through your story, through your journey, you can help the next person who's probably struggling with, how do I address this? How do I deal with this? And, there's a lot to it. There's a lot to it. And I'm really excited that we're really talking about this. But so what would be your advice? What advice are you going to offer to men before we shut down? But I know that we're going to have to talk about this more.
Yeah,
we're going to have other forums. This is just the first section, and we're going to talk more, because it's deeper than what we think. So for today, what would be your advice to men?
My advice would go to both men and women, actually. My advice to men would be, I think I've kind of dropped crumbs all through this chat, but I'll just gather all the crumbs into one meal, right? Be vulnerable. When it's necessary, be vulnerable, be open, accept help, accept support. Don't live in denial. Get the right kind of knowledge, because sometimes when you think about being a closed up structure, is you are not open to a lot of things, including knowledge, right? So maintain an open mind, maintain a cordial, open, two-way communication with your loved ones. And then to the women, it's not easy for men to open up. But when your man opens up, don't weaponize it. I'm saying this because it happens a lot. Women, some women, the reason why many men don't open up is because some women tend to weaponize vulnerability. And then use it against the man later on. So many times, let me tell, because I'm a man, right? And I'm a psychiatrist, so I speak to many men. And so you just find out that many men, sometimes they want to open up. And then when they remember that, okay, this may not just be a listening ear, this may actually be someone who will take these words and stab me later on with them. They just decide not to. They would rather just talk to their fellow guys over a bottle of beer, or just and many times what happens in such cases is we tend to water it down, just make a joke out of it and then laugh and move on. So when that happens, you've not actually opened up fully, and you've also not gotten help after opening up. You've just kind of watered it down, So men open up, women listen.
Thank you. Thank you so much. That was very important. As they start to break down the pride and that wall, it's best for the women, for us to kind of embrace it and be there for them. Thank you so much, Dr. Tolu. I really appreciate this. I am going to come back with more questions to ask you. So for people watching, please stay tuned. There's so much, where we have more topics to come. addressing breast cancer and men. And Dr. Tolu, thank you so much.
You're
And
welcome.
please watch out for the next one because I will be getting him back on the show so we can get Thank you.
All right. Thank you
Stay
for having
blessed.
me. This has been lots of fun.
Thank you. Thank you so much.
All right.
Bye, guys.
Bye.